necessarily those of this station, its staff, management, or sponsors.
Are you a family caregiver? Are you caregiving for someone who can no longer take care of themselves? Are you overwhelmed? This is Caregiver Solutions Info with Marsha Teal. Marsha will be hosting an hour of true stories and information, tips and updates of the latest research and necessary information in the caregiving field, focusing on you, the family caregiver. An Alzheimer's disease and dementia care expert, Marsha has 15 years of hands-on experience at Arden Courts, a leader in assisted living dementia communities here in the U.S. Marsha covers everything you need to know as a family caregiver, especially if you care for a loved one with Alzheimer's disease or other related dementia or chronic illness. If you have a friend or relative that is also a family caregiver, call them now. They won't want to miss a minute. And let them know they can watch on caregiversolutions.info. And they can listen on WNN 1470 AM in South Florida or nationally on the iHeartRadio app. Now, sit back, relax, and learn from our host, Marsha Teal, as she brings information to you that may just be the caregiving solution you need.
Hi, everyone, and welcome to Caregiver Solutions Info Show. I'm Marsha Teal, and I'm your host today, and we are going to have another wonderful program. If you're a caregiver, a family caregiver, someone who's taking care of someone else who can't take care of themselves, then this show was designed just for you, especially for you. It's a great educational format to learn about all things about caregiving and a lot of things about dementia, whether it's Alzheimer's disease or some other kind of related dementia. So we tie those in to help the caregiver learn all they can about what to expect as they go along their caregiving journey. So we have many experts in many different fields: financial, social, legal, medical. And today we have two experts that I'm really excited to have on. And we're going to be talking about Florida Medicaid. Now, a lot of people may be wondering if you're a caregiver or you're an adult child and you have parents that live in Florida and they're needing care and maybe the money's running out. Maybe they don't have a lot of money and they need more help and you're not sure what to do and how are you going to pay for it. I know I've talked to some adult children who kind of foot the bill for their elderly parents and they've lost their job because of the COVID-19 pandemic or for other reasons, and they said, I don't know how I'm going to be able to afford to take care of mom and dad. They just don't have the money. So this show is going to address that and much more. So you want to tune in, take some notes, and learn from our experts. Today, joining me on the show, we have a Florida elder law attorney. His name is John A. Williams, and John is in practice in Florida for about 20 years. He specializes not only in Medicaid eligibility planning, but he also handles business planning, estate, tax planning, and trust. So he has a lot of experience in elder law and everything that goes along with that. So he's joining us today. And also we have Kathy Kessler. Kathy is a senior advocate. She's been helping seniors and their families in the medical field, in the assisted living, the nursing home environment, the hospital home health environment for about 20 years. And she's been helping lots of families with Medicaid planning and getting the kind of services that they need. And she also is the head of her company, Medicaid and More, based here in South Florida. We want to thank you for coming, both of you. I'm so excited that you're with us today, and I'm looking forward to hearing everything that you have to talk about. So welcome to the show.
Thank you. Very good to be here.
So let's start off out, the first thing, John, with the very simple, basic explanation, because a lot of times I've talked to caregivers, they really are in the throes of caregiving for a long time maybe, and they have to do something, and they haven't really done their homework and they don't know a lot about even what is available to them as far as assistance from the state of Florida, the government, to help them, and they don't really even understand the basic differences between Medicare and Medicaid and what kind of benefits that those two programs afford. Can you give a brief explanation between the differences between Medicaid and Medicare?
Absolutely. So Medicare is for elders who are over 65, and that covers a lot of medicines, hospitalization, and doctor's visits. What it doesn't cover is long-term care facility, kind of care in a long-term care facility like assisted living or a skilled nursing home. So a lot of folks believe that Medicare is going to be the answer, that they have coverage already for any kind of thing that may come up, including a long-term stay in a rehab or a long-term care facility or assisted living facility, but that's not true. But the Medicaid system is what kind of comes in as a supplement to Medicare, and with proper planning can come in and lighten that burden of a long-term care stay.
Okay, great. So Medicare does supply some care in a skilled nursing facility, like in rehab after you've been in the hospital for so many days. But what you're saying is it's not for the long haul. It's not for a long time. It's a set number of days or months.
Right. So if you're coming out of a hospital stay, Medicare is going to pay the first 20 days at 100%. For some people, that's going to be enough. They will also pay the next 80 days at 80% coverage, which for other folks may also be enough. But it's beyond the 100 days that Medicare will drop off, or if Medicare determines that the patient has plateaued, that the therapy is not causing an improvement or resulting in an improvement, after the 20 days, Medicare can drop the patient if that plateau occurs. So you're not guaranteed the next 80 days for a total of 100. You're guaranteed the 20, but you're not guaranteed 100. So anytime in that time frame, Medicare can be cut off.
So it's good to know, because then when someone needs long-term care, in other words, maybe staying the rest of their life in a nursing home, it can be pretty expensive, as Kathy's going to share with us. But, that's when, if you don't have those funds, that's when they might be wanting to look into what Medicaid can do. So that being said, Kathy, I know that you're also an occupational therapist. You've been in the work setting with assisted livings and nursing homes for many, many years, helping people to figure out what they need for care and how to pay for it. You have been helping caregivers a very long time, so you know also the cost of what these types of care run. And can you just give me a approximation of the difference cost between maybe a home health, if someone gets care at home, versus an assisted living facility versus a skilled nursing facility?
It would be my pleasure. Thank you for asking me that question. So the average home care industry charges $20 to $22 per hour for an aide to go to the home and care for someone. So if they need 24-hour care, it will add up very quickly to be just about in comparison to going into a skilled nursing facility. Now, a skilled nursing facility is approximately $10,000 to $11,000 per month is private pay costs. And then an assisted living facility, that's a private industry, so they have various ranges. I've seen some as low as $1,800, but the ballpark is around $3,000, $3,500. They can even go up to $6,700 I've seen as well. And it depends on several factors: the location, what size of room you have, if it's shared or private, and then the level of care that you need as well. So that gives you a big surplus of variations depending on the needs.
And I also know that as the care gets greater, usually the cost gets greater, right? So if someone's in an assisted living and they have maybe dementia and they need a specialized assisted living, that's going to add on extra cost as well. Is that right?
That's right. So the biggest difference actually is with Medicaid is to know that it pays differently depending on what kind of setting that you're in. So for instance, in a skilled nursing facility, it will pay for the cost of the care and you're able to keep a portion of your income. And then so if your income is $2,000, you are able to keep $130 for your personal needs. And then Medicaid and your income goes to pay for the care in a nursing home. So you know that you would not have more out-of-pocket expenses other than your income. If you're in an assisted living facility, it's changed differently, that the Medicaid pays approximately $1,300 towards the care. So since the private industry is an assisted living facility, then you have to negotiate what that cost is and find the proper facility based on the income that you have, because it can be very expensive and it only pays $1,300 towards your care there.
So this is where people start getting mixed up and confused because, you know, it's a lot of detail, you know, and like, as they say, the devil's in the detail where, you know, how do I know what I need? How do I know how to get it? How do I know if I qualify? So we're going to delve into this as soon as we come back from a quick break, and you're going to talk about how this happens. So we'll be right back. Stay with us.
Thank you.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
Welcome back to Caregiver Solutions Info Show. My guest today is Kathy Kessler from Medicaid and More, and John Williams, Elder Law Florida attorney. And we're talking about Medicaid today and what it means. How do you know if you qualify? And if you do, how do you get it? So there's a lot of questions we have to learn about Medicaid. And I do want to stress we're talking Florida Medicaid here. So if you are watching or listening from another state, you want to check out your own state rules and regulations regarding Medicaid, but this should give you a good overview and the gist of what's going on. So, Kathy, being in a setting where you have been around a lot of people in healthcare settings and you're an occupational therapist, that gives you somewhat of an advantage because the question I'm going to ask is, how does someone know if they need more care? So let's say someone's home and they're doing well, but they're getting older and maybe their condition is getting worse, and the family's wondering, how do we know when they need to go to the next level? And so that's one question that you can help us with because people aren't sure what to do and when to do it. So how does somebody know when they need to go to that next level of care?
So you're going to look at couple different areas. You're going to look at your social support and what your network is. If you're able to stay home, I mean, everyone wants to stay home if they can, and we encourage that as well. That we want them to try to thrive in the home environment for as long as possible. So you'd want to look at your social support. See, is it, as your functional level deteriorates, do you have the staff there, or family, or friends, or neighbors, or associations that could help you to maintain your highest level of function there in the house? Then you also want to look at your finances. Maybe you only need someone to be there for meals. So maybe you would only have to pay for a home care aide for a few hours a day, and you can afford that. But as your needs and demands and gets greater, then you're going to need more care. And so you look at your funding as well to see if you are able to maintain that at home. You also want to look at your loved one's cognition and their safety skills. You know, are you concerned that they're going to walk out of the house and get lost and not be able to return? Are you going to be concerned that they may not be able to get in and out of the bathroom or the toilet or the shower? Are they turning on the stove? So as you know, memory also is a big plays a big role on how long they can stay home or not, and if there's someone in the house to help them. And you know, you're going to look at their functional level as far as what can they do. Can they bathe themselves, dress themselves, do their medication management, meal prep? So it usually is a family decision at some point that it's just no longer viable. And so then at that point, that's how we look at their finances and then their functional level together to see what's the proper area for them to go to. And again, we always want the least restrictive placement as possible. So it's home, then assisted living, and then nursing home for long-term care.
Great. Well, that was a great explanation. So let's say with your help or with a senior advocate, they've decided, the family, that we do need to get more help for mom or dad or for the spouse, but they're thinking now, gee, we looked into the costs. I'm not sure we can afford it. And so, John, I'd like to ask you to talk about the next part of this, is the criteria. So, you know, Kathy explained the criteria of, like, how do we know we need it? But now let's talk about the criteria that the state of Florida looks at to see if someone is qualifies as a possible beneficiary of Medicaid funding. And you can explain that to us, please.
Yeah, absolutely. So they really look at three things. One is, do they have the need? Is there a medical need? Do they need help with some of the activities that Kathy just mentioned? And that's usually pretty cut and dry. The other tests are financially based. So one is income. Does a person make more than $23.49 per month? So the threshold is $23.49. So if you are under that, you meet the income test. The other is the asset test. And for Medicaid, you can't have more than $2,000 of countable assets or non-exempt assets. So most people have more than that in assets. Some people have more than that in income. So there are things that we can do. There are planning tools to get around that problem. There's a special kind of Medicaid income trust that can be set up if someone's income is too high. And there are other planning tools if someone's assets are too high. There are, when I said $2,000 of countable assets or non-exempt assets, I mean things like things in excess of the home. The home is exempt. One car is exempt, plus another vehicle if it's more than 7 years old. IRAs are exempt if they are throwing off monthly income. So if you are 72 years old and you're getting the required minimum distribution out of your IRA, the IRA could have $100,000 in it, but it's still an exempt asset because it is throwing off that income. So most people are going to need to look at their checking, savings account, and brokerage accounts. Those are, or annuities. Annuities are also a countable asset. So people who are seeking to obtain Medicaid benefits are going to need to look at those types of resources. And those are the thresholds.
So I think this is some of the confusion where it comes in, where people don't know what counts and what doesn't count when you're trying to calculate eligibility for Medicaid, because they would say, oh, I have, a big house and I've got plenty of money in the bank, but they might be talking about, like you said, IRA monies. So if someone has a huge IRA account that they've saved their whole life, then I understand what you're saying is that the government doesn't expect you to pull all of that out and pay for your long-term care. Is that correct?
That's correct. The only thing that they're going to look at is the income that's being generated by that IRA, the RMD, required minimum distribution. If an RMD is coming out of the IRA, then Medicaid will want that income to be used to pay the facility, along with the other income, like Social Security or pension income. So the sum total of a person's income, including the IRA distributions, will be part of the person's pension responsibility. However, the principal in the IRA will be exempt.
So I know that maybe at no fault of their own, some people just don't have a lot of money. They live paycheck to paycheck, or maybe something has happened during all their working years where somehow they've lost all of their assets. They have very little income now, and they really don't have much. And I've seen many people, in that boat. And when you're looking at Medicaid requirements, it seems like that's sort of like a slam dunk, as I call it, because they definitely meet the criteria. They need the help. They don't have much income, and they certainly don't have much in assets. So that's a slam dunk. But it's the tricky part when they're not a slam dunk, what people can do to qualify. And and I think this is helpful for a lot of people that don't realize that there are things, because what if somebody has maybe some but not quite enough, and helping them to be able to afford to get over that threshold where they can get some help and still get what they need. So that's what we're talking about today, and it's going to help a lot of people to at least think about this. And speaking of thinking about it, I wanted to ask either one of you, jump in, when's the best time to start thinking about Medicaid? Because can you just apply and get the money, or how long does it take? Is it a long process to make the application? What are your thoughts on that?
Well, I would
John,
say
you want to take that one?
Sure. I would say whenever you notice that a loved one is declining and you see that caring for that person in a facility setting is probably the safest bet. A lot of people can try to take care of a loved one in the home, but sometimes it's just not safe. So if you get to the situation where it's just not safe, or the person is, the loved one is incapable of helping themselves, that's when it's a good time to start planning. I just described the thresholds for assets. There are planning strategies for those who do have more than $2,000. Do not dismay, because there are plenty of planning avenues to take. And I don't know if you want me to get into those in particular, but there are some great planning tools in Florida. Florida is one of the best states in the country to be able to plan for those who have more than $2,000 in countable assets. So given that there are tools in the tool belt, the sooner you get started and the longer you give yourself to conform to those tools, the better you are.
Okay, so it's not ever too soon to start.
I think the sooner the better, because once you're with an elder law attorney and he tells you how to progress to get things prepared, then you're ready. So you don't have to running around at the last second when you are already so concerned. You have so many other choices. Who's going to take care of mother? Where should she go? Is she safe? Is she in the hospital? Then everyone's in crisis management. And especially right now with the COVID-19, we've had a very difficult time trying to get things from banks and, getting notaries and things that we need to have done has been even more difficult during this time. So I would say the sooner that you prepare, the better and easier it will be for you in the long run.
Well, that's great. There's a lot to learn, and there's a lot to tell people about this, because not only you have to make application, but you've got to do, like you said, Kathy, go to the bank, have some proof, have some statements. It takes time to accumulate all of that information together. Unless someone is super organized and have organized their whole life during the stay-at-home pandemic, most of us don't have all of that at our fingertips, and it makes it a little harder when we have to produce everything. When we come back from our break, Kathy, I'd like for you to talk about the statewide Medicaid management programs, because that can get a little confusing too, because let's say that we know mom needs help and we decide that she doesn't have the money, and we know that we have to maybe apply for Medicaid and go see someone to help us through it. But then where do we go from there, and what are our options? So we're going to take a quick break, and Kathy, when we come back, you can tell us all about that.
Sure.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help, because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'd like to take this opportunity to thank our national sponsor, Arden Courts Memory Care Communities. Arden Courts has approximately 55 assisted living memory cares across the United States, and they are a great resource as they're a leader in the memory care field. As such, they would like to offer you an extra resource just for watching this program. And this is a book called The 36-Hour Day. It's a wonderful book for caregivers. It talks all about dementia and about caregiving, and it gives lots of tips and explanations and information that you as a family caregiver would find very, very useful. So if you don't have this book and you'd like to have it, it's absolutely free. All you have to do is contact Arden Courts via email and let them know that you actually saw the offer on the Caregiver Solution Info Show. Give them your name, address, phone number, and they'll be happy to mail you a copy of this book right to your door. So the email address to send that request to is Delray, D-E-L-R-A-Y, at arden-courts.com. Again, Delray at arden-courts.com. So email them, let them know that you'd love to have a copy of the book, and I highly recommend this for anyone who hasn't read it or they need more information, whether you're a seasoned caregiver or whether you're just beginning the journey. I'm sure there'll be something for everyone that can be helpful to you along the path of caregiving. So today we're talking about Medicaid, And joining me today is Florida elder law attorney John Williams and also Kathy Kessler, who is a senior advocate with Medicaid and more. And we're talking all things Medicaid, what it is, what it'll pay for, how to get it, how to know all the ins and outs. So Kathy, you got a little feedback there. Maybe turn down your sound a little. We want to investigate a little bit more about the statewide Medicaid managed care program. Kathy, can you explain what that is?
I sure can. So once you apply for long-term Medicaid and are approved, then the following month, then you would choose a statewide Medicaid managed care program. So there's 3 divisions within statewide Medicaid managed care. One is for the MMA plans, which is the Managed Medical Assistance Program when you're in the home environment. Or there's a LTC program, a long-term care, which covers services when you're in a skilled nursing facility. And then there's a dental program. So the Managed Medicaid program is actually like an HMO program that Medicaid has paid those services to render the care that you need. So you would have a case manager through Medicaid, and they would verify what you need. If you need more care, if you need durable medical equipment, they would be your care manager through Medicaid to provide the services that you need.
So, but when someone is going through this process and once they do get approved, they don't have to worry about what they need to do next. It's sort of someone takes their case and helps them along. Is that correct? So they know what to do next or when to do it?
Once you become approved for Medicaid, then you'll receive documentation from the statewide Medicaid managed care, and it'll show you the different programs that are available in your area. So there might be 4 different programs, just as to give a symbolism, just as there's Humana and United and Care Plus or different HMO programs through Medicare. Statewide Medicaid has the same kind of thing. So there's Florida Community Care, there's Humana, and United. So they have their own HMOs. So they would provide you the documentation. You would look to see which program offers what amenities, and then you would choose that. If you do not choose one of the programs, the state will choose one for you. And then you would have a care manager through Medicaid to deliver those services.
Great. Thank you for explaining that. So backing up for a second, let's say someone has applied for Medicaid and all of a sudden they've been deemed something called Medicaid pending. What does that mean, Kathy, and when is it used or when is it applicable, and how do you explain what that means?
So Medicaid pending means that you are in the process of preparing to become Medicaid eligible. So just as what John was saying, as far as the income limits and the asset limits, or working with an elder law attorney to do your planning, then you would be in that process. And so we say someone is Medicaid eligible once all of the assets and income are within the Medicaid allowable limits. So they are in a Medicaid eligible, means that they are ready to apply for Medicaid and will be approved based on the information that we have. And Medicaid pending means that you're in that process of doing the application process to get ready to apply.
Great. So we're talking about applying for Medicaid. I'm sure there's a lot of information that they require. Applications are probably pretty long, I would imagine. But John, can't somebody just apply on their own and do it on their own without any professional help? And if so, what are some of the ramifications of that?
You know, I believe that there are some people who are capable of doing it on their own if they are already within the allowable limits. You know, if their income is under 2349, their assets are under 2,000. Some people are capable of doing that. I do believe that. But most people are not within those limits. Most people do not meet both of those criteria. And whenever that is the case, the application becomes much more complex. I've heard of employees at nursing homes doing it themselves for their own family members and failing because there are just so many nuances. You know, one thing that a falsehood that I'd like to dispel is, and I get a lot, is, John, you're telling me to do these things to protect my assets, but what about the 5-year look-back rule? We can't violate the 5-year look-back rule. What about that, John? And although there is a 5-year look-back rule that says that you can't give money away during the 5 years leading up to application, that doesn't mean that there aren't strategies that you can employ that are legal and legitimate that are exceptions to the 5-year look-back rule. So don't let the 5-year look-back rule scare you, because there are various exceptions to that rule, and many of them are options that are very attractive and don't require anything too exotic.
Well, that's great to know. I dealt with a few people during my years working with caregivers directly where they have attempted to apply for Medicaid on their own, and unfortunately, you know, they were denied or it got kicked back for something very simple. Maybe they didn't check off a box. Maybe they left a box blank when they should have put something in, a 0 or a NA for not applicable, but they left it blank. And there's all kinds of little things that if people don't know exactly how to cross the T's and dot the I's, that it can be rejected. So I think it's important for people to understand that, you know, yes, like you said, you can try on your own, but be very careful, right? Because things can get kicked back, or maybe you didn't put in the right information or the wrong information, and then, you know, you got to start all over again. So I've seen those situations myself, and it was really hard because the family had to wait a long time to get it rejected, and then they had to start all over again. And so I just want to put that out there because I've seen, you know, both types of situations. John, can somebody actually, once they get approved and they're on Medicaid and they're doing well and they're getting the care that they need, can they actually get kicked off of Medicaid? Is that such a thing?
Well, they do have to go through a recertification process each year, and if they no longer meet the eligibility requirements, their income went up, or their assets, they acquired new assets, they can lose Medicaid. So it's really important to seek a qualified elder law attorney to make sure that all these ducks are in a row and continue to be in a row. So one thing that we do is we are careful to advise our clients moving forward, looking into the future. It's not just about getting qualified now, but it's staying qualified. So the only thing that really can kick you off Medicaid is if at recertification time you sell an asset that was otherwise exempt. For example, a homestead that's exempt. And I've had people come to me and say, you know, we sold a home and we put the money in mom or dad's bank account. The home was an exempt asset. Why are we in trouble now? Well, that exempt asset suddenly became a non-exempt asset because it's now cash. But again, there are things that can be done with that cash to protect it, but you need good counsel to make sure you know how.
Okay, well that could be a big mistake in a way if you didn't know what to do, and that kind of makes sense. So every year you have to reapply, but it's not the same process. It's more or less just an update to everything.
It is an update. You're just making, you know, you're letting Medicaid know. The Department of Children and Family Services is the agency that runs Medicaid. Letting DCF know whether anything has changed. If nothing has changed, then you let them know. If something has changed, like you've sold an asset, or you inherited money, or you've won the lottery, or your Social Security cost of living adjustment up put you $1 over the 2349 limit, which can happen, you have to let them know and you have to adjust.
Yeah, it's very specific, so you want to be sure you follow all of those guidelines. That is something. What about when someone has applied, Kathy, for Medicaid and they've waited, I don't know how long, maybe a couple months, few months, but now they are eligible to get those funds. Are the funds that are given to them retroactive from the time they applied, or do they start during the month that they were accepted? Is there a rule on that, Kathy?
Yes. So once that they are in a skilled nursing facility setting, and it does take approximately 3 months to get approved, and as long as that they were Medicaid eligible from the month that we are applying for, it can go back to that month that they were eligible based on once it's approval. So like we've applied for someone in May, and we just got approved sometimes in July or August, and as long as in May they were under the guidelines as John has stipulated, then they were approved and it would go all the way back to May. So in a nursing home, they would only be responsible to pay for their income, their total income to the facility, and the rest of the bill would be covered by Medicaid from May
Great.
onward.
Okay, good to know. Very good to know. We're going to take a last short break. When we come back, we're going to hear more about Medicaid do's and don'ts from Attorney John Williams and Kathy Kessler from Medicaid and More. So we'll be right back.
Arden Courts is not just a place to live, it's a place to call home. Residential living combined with quality caregiving. This is the philosophy behind Arden Courts. Communities created exclusively for individuals with Alzheimer's disease and related dementia who would benefit from a safe and structured environment. For additional information about any of the unique services Arden Courts provides, call 888-478-2410 to locate a community nearest you. Inquire about our educational seminars, resource library, or support groups, or simply feel free to ask questions you may have about Alzheimer's and related dementias. At Arden Courts, we know, we understand, and we can help because memory care is all we do. Remember, call 888-478-2410 for additional information about any of the unique services Arden Courts provides. You are listening to your host, Marcia Teal, an Alzheimer's disease and dementia care expert on caregiversolutions.info. If you have a question or wish to share a story, call into the show at 888-565-1470 and talk with Marcia. Now, back to Caregiver Solutions.
I'm talking today with Florida Elder Law Attorney John Williams and Kathy Kessler of Medicaid and More about Medicaid and about what you need to know. So, John, I have a question for you. We're talking about applying for Medicaid and the rules and the criteria and the stipulations. What about a specific scenario where maybe you have a husband and a wife, and the husband's very ill and he needs more care than what the wife can do? So they're going to have to put him into a nursing home. And, you know, they have some money, right, that maybe they could pay for the nursing home at least for a while, but that doesn't leave the wife any money to live on because she's still healthy and viable to live on her own. So she needs money to live on. Can you help somebody like that?
Absolutely. So under the rules, a spouse in the community, the one that is not applying for Medicaid, is allowed to have $128,000 and change in his or her own name. So assets can be shifted around so that the applicant spouse is under the $2,000 mark, and then the remainder of the assets are in the spouse's name, the community spouse's name, up to $128,000. Now, in that scenario, if those criteria are met, and if the spouse in the home can prove certain homestead-related expenses, then the spouse living at home can utilize some of the patient spouse's income. Medicaid will calculate how much that is based on the true expenses, the household expenses, like rent or mortgage, utilities, phone, cable, those kind of things. So Medicaid's going to look at that to make sure that the spouse can afford to live, and only a certain amount, a reduced amount, is used by the patient to use that income, the remainder income, to pay the patient liability.
Great. Well, there's then things that people really need to know and to realize there. So there's it doesn't hurt to ask. I always say that. You know what? It doesn't hurt to ask and find out. You may learn something that can help you. And speaking of helping people, Kathy, you've been doing it for 20 years now and working in healthcare settings, helping people and doing some Medicaid applications for them. Have things changed over the years? Do you see any significant change in 20 years between when you first started doing this and helping people to now, or is it really pretty much all the same? People are doing the same things and with the same questions and the same problems. Do you see any trends going on here?
Well, I feel that people are more willing to get the care that they need and deserve, as opposed to in the past, people were more steadfast about staying in their home environment. And if they didn't have the money or weren't able to afford the care, they would just toughen it out. But I don't know if it's because of the different facilities are maybe more knowledgeable, or they have friends that are more knowledgeable, that they know that there are resources available. And so now I feel that they're reaching out more to be more willing to do the planning and to see what their other options are if maybe an assisted living or a nursing home is in their best benefit. And I feel that more people are feeling more accepting of moving into a facility to get that care, whereas in the past I feel they were more resistant, not wanting to maybe admit that they needed help. So the Medicaid process is very difficult. It's very challenging to get through. There's no rule book that you can just go and get an instruction manual and figure out. It is best if you work with a professional who can guide you through the way, so you are more likely to get approved for Medicaid. And it will save you so much money in the future because you'll have your services covered for you. And then you'll get the care that you need and deserve. There's no reason to stay at home and to suffer and not have food or care or medicines. There's resources out there, and we are here to tell you about them and to show you how to access those benefits.
So that was a perfect segue to my next question, Kathy. Your company is called Medicaid and More. What's the more?
The more is that my 20 years of experience and my concierge, I would go to your home. I would help you have an itemized list and be organized, collect the information. I work very closely with John. Anytime we need legal advice, he is the one that would provide you that service there. He provides us the guidance, the planning, the documents, and then I would help that family to collect it all together. I've filed the application to Medicaid, and John oversees all of the legal advice and the transactions that are happening, and we work collectively to make sure the client gets approved, and hopefully the first time around, so that there's the minimum amount of out-of-pocket expenses, and they're able to maximize their savings as much as possible.
Wonderful, great. And speaking of documents, you are an elder law attorney, John, in Florida. Tell us, we have a few minutes left of the show. I want you to explain the necessity of having certain documents in place before you get to all of this with Medicaid planning, because of people are going to need certain legal documents, what are some of the legal documents that everyone must have?
Well, I would say a power of attorney is probably the most important thing, because whether you're married or you're not, if you are in a nursing home or assisted living and you're not able to go to the bank to conduct transactions, to do the planning, to implement the planning that we're recommending, then it's very difficult to implement that plan. If you're in that boat and you don't have a power of attorney and you are stuck having to do something with your finances, you may have to go through a guardianship, which is not desirable. It's not the end of the world, but it's not desirable. So a power of attorney is the thing that can avoid a lot of headaches. Kind of piggybacking on what question you asked, Kathy, a little while ago, changes that we've seen, changes that I've seen, are people are living longer. The time of having my average client be in their 70s, my average client is now in their upper 80s. So it's a big change, which also means that as people are living longer, their stay in a nursing home may be longer and the expense can be greater. So that makes it even more important to seek good counsel to make sure that those expenses are kept to a minimum through proper planning. So a power of attorney is definitely...
Yeah, as we know, yes, and we know prices keep going up. You know, a lot of the expenses and inflation and prices are going up, and you got to plan for all that. Nothing stays the same, right?
That's right.
So, Kathy, if somebody is listening or watching the show today and they said, gee, I would like to talk to somebody about Medicaid and see if maybe someone in my family might be eligible, or maybe to ask other questions, is there a way that they can contact you, Kathy?
Oh, absolutely. So Medicaid and More, our webpage is medicaidandmore.com, and my direct number is 561-809-9575, and I can make Medicaid easy for you. So Medicaid and More is here to make the Medicaid process easy.
Wonderful. So give your number again, Kathy, just in case they didn't catch it the first time.
Sure, of course. Again, it's 561-809-9575, or online at medicaidandmore.com. And it's
Wonderful. So if
Medicaid, Medicaid and then ANDMORE, medicaidandmore.com.
Great, got to spell that out. So if you're in Florida and you have questions about Medicaid, you can call Medicaid and More and speak to Kathy. If you are deemed you need more help and more legal expertise in your situation, Kathy can put you in touch with John. They're a team, they work together. And John, you have a website too, don't you?
Yes, it's pretty simple. JohnAWilliamsLaw.com. JohnAWilliamsLaw.com. And my direct dial is 813-280-0789.
Wonderful. Well, I want to thank you both so much for being on the show today. It was a pleasure having you and learning all about what you do and your expertise and how you can help people. So thank you very, very much.
Thank you so much,
Thank you
Marcia.
so much for having us today. It was a real pleasure.
Well, I enjoyed it a lot. So best of luck to both of you. And thank you, the audience, for listening or watching the show today. You can tune in every Tuesday from 6 to 7 p.m. Eastern Time on caregiversolutions.info on the website. Listen on the iHeartRadio app. We're also heard on local Southeast Florida radio stations. So until next week, take care. We hope that you get through this pandemic sooner than later. We're all struggling, but we're getting through it together. And hope to see you next week. And you guys out there have a good evening, and we'll talk to you soon. Take care and have a good night.
Bye. Bye.
Thanks for joining us for this week's Caregiver Solutions with Marcia Teal. Join us next week as Marcia, who has 15 years of Alzheimer's disease and dementia care experience, brings you more needed information to help with the care of your loved one. This show can be seen again on caregiversolutions.info, and questions can be left on the site, which may be used on the program to help others. See you next week for more Caregiver Solutions.